Hello, my name is Lars Tönges. I'm a postdoc in the Department of Neurology at the University of Göttingen, Germany.
Hi, my name is René Günther. I'm a medical student and I'm doing my thesis work in this lab.
Today we are going to show you the clinical testing of the SOD G93A mouse model of amyotrophic lateral sclerosis. Furthermore, we'll demonstrate a motor function test with the so-called rotor rod test and additionally another motor function test with a hanging wire grip.
In order to perform an immunohistologic analysis after functional testing of the ALS mice, a necessary procedure consists in the removal of the spinal cord, the sciatic nerve and the gastrocnemius muscle. We want to show this surgical procedure in detail and want to present some exemplary immunohistologic findings at the end.
Okay, but now let's first start with the clinical testing. This is a free-moving wild-type mouse that does not show any clinical symptoms like muscle tremor or paresis. In our clinical classification system, that would be score 4. This is a transgenic ALS mouse in an early disease stage. It exhibits a severe tremor of the right hind limb that classifies it as score 3. The severe gait abnormalities classify this animal as score 2. Dragging of at least one hind limb are classified as clinical score 1. In the hanging wire test, crude muscular grip strength is evaluated. Each mouse is placed on a custom-made wire lid and cautiously turned upside down above a straw-covered bottom. After training for 3 consecutive times of at least 180 seconds, the latency to fall is measured. Each mouse is given up to 3 attempts to hold on to the inverted lid for a maximum of 180 seconds and the longest period is recorded. In comparison to the white wild-type mouse on the right side, the black transgenic mouse on the left is very weak and falls off the lid before reaching the maximum. The rotor rod apparatus is used to measure motor coordination, balance and motor learning ability. A good performance requires a high degree of sensory motor coordination. It consists of a computer-controlled motor-driven rotating spindle and 5 lanes for 5 mice. Faults of the mice are detected automatically by pressure on a bottom plastic plate. After training for 3 consecutive times of at least 180 seconds at a constant speed of 15 rounds per minute, the time for which an animal can remain on the rotating rod is measured. Each animal undergoes 3 trials, and the longest latency without falling is recorded. The healthy wild-type mouse on the left-hand side is running without difficulty on the rotor rod. In contrast, the transgenic ALS mouse on the right side has severe problems to even remain on the rotor rod and slips off after a while. Observed from behind, you see the severe running difficulties of the left transgenic mouse. In comparison with the healthy wild-type mouse, it is not able to keep up with the rotor rod speed and cannot push upwards with the hind limbs. In order to perform an immunohistochemical analysis of the spinal cord, the animals have to be sacrificed. It is very important to always strictly follow the local guidelines for proper conduct of animal experiments in this context. In this very simplified overview of the vertebral column and its surrounding tissues, the main anatomical structures are depicted. We will place the animal on its ventral side and start to prepare the muscles from the dorsal back. After the muscular tissue is removed, we will access the vertebral column that encloses the spinal cord. After the animal has been sacrificed and perfused with a paraformaldehyde-containing solution, the spinal cord can be removed. The animal is placed onto an operation table and the forelimbs are fixed on the sides in order to expose the backside of the mouth. The animal is wetted to flatten the hair coat and facilitate the following skin incision. For this, a sharp scalpel is used. Be careful to stretch the skin to both sides to facilitate cutting. If leg muscles shall be prepared, their skin has also to be incised. After the skin incision is completed, it is gently pulled aside with a pair of tweezers. Having removed the leg muscles and the sciatic nerve, we continue to approach the spinal cord and place the animal on a new operation table. Now it is easy to identify the cranium, neck muscles, and spinal column. Having identified all these structures, it is easy to proceed to the next step. The muscles of the neck and the nuchal ligament have to be removed. Be careful not to incise too deeply and lesion the vertebral column. In the next step, the paravertebral muscles are removed entirely to expose the vertebral column. In order to access the spinal column, several laminectomies have to be done. We start from the cervical part of the vertebral column, including the atlanto-occipital joint. To perform the laminectomy, you have to cut the vertebral arch to be able to remove all the vertebral processes from the vertebral body. As explained before, the laminectomies start with the cutting of the vertebral arches. Then the laminae can be pulled away. Again, take care not to lesion the spinal cord. As many more vertebrae have to be removed, it is quite helpful to use angled scissors and incise several vertebral arches of both sides at a time. Then pull on the dorsal processes to entirely remove the vertebral laminae. In the close-up, you see that the pair of scissors have to be carefully inserted most laterally at the side of the spinal canal. Remaining lateral parts of the vertebral column have to be removed to facilitate the later complete removal of the spinal cord. An anatomical landmark of the spinal cord are the so-called cervical and lumbar intumescentiae. Having finished the laminectomies of the entire spinal cord, make sure that you also transect all ventral roots of the spinal cord and release it from the dura mater of the meninges. Next, the cervical spinal cord is cut cranially and its removal is started. Again, touch the spinal cord very cautiously in order not to harm this tissue, because this could cause severe limitations for later immunohistochemical analysis. The removal of the spinal cord is further continued at the thoracic level and proceeded to the lumbar part. It is finally cut again, this time at the site of the cauda equina. Now we are able to completely release it. Here you see the spinal cord placed right next to its original location in the vertebral column. Ultimately, it is placed into a paraformaldehyde post-fixating solution. As a classical example for spinal cord immunohistochemical analysis, you can apply an antibody that recognizes choline acetyltransferase to identify motor neurons in the spinal cord anterior horn. Here, you see a large number of motor neurons in a healthy wild-type animal. In contrast, the transgenic ALS animal at end stage does exhibit a much smaller number of motor neurons in the anterior horn. Watching this video article, you should have learned the basic clinical examination of the SOD G93A mouse model of amyotrophic lateral sclerosis. Two motor behavioral tests have been demonstrated, the rotor test and the hanging wire test. They provide a good ability to evaluate basic motor function, they are easy to perform, sensitive in detection of motor deficits, and time efficient.
The main part of this video consists in a demonstration of the preparation technique of the spinal cord. This can of course be applied to any other mouse disease model and is an essential step for the later immunohistochemical analysis of disease pathology in the spinal cord.
Thank you for watching. We hope that this video article will be helpful for your future experiments.